Hello, my name is Ted Weinberg, and today I will be doing a presentation of Asperger's syndrome. The reason I chose this topic is because I once had a roommate and friend who confided in me that he had the condition. Without knowing anything about Asperger's, I decided to take this opportunity to learn more about AS and educate myself on how to teach these students. For the sake of this presentation, I will be referring to the individual I mentioned before by the name Dave. The World Health Organization defines Asperger's syndrome as a disorder of uncertain validity characterized by the same type of qualitative abnormalities of reciprocal social interaction that typify autism together with a restricted, stereotyped, repetitive repertoire of interests and activities. It differs from autism primarily in the fact that there is no general delay or retardation in language or in cognitive development. The disorder is often associated with marked cleanliness. There's a strong tendency for abnormalities to persist into adolescence and adult life. Psychotic episodes occasionally occur in an early adult life. Those with AS have higher intellectual capacity while struggling with lower social capacity. Prevalence. According to aspergerdeathsyndrome.me.uk, there are currently 68 million people who suffer from the highest form of functioning autism. That translates to roughly 0.5 to 1% of the world's total population. It is more likely to be found in men over women. It is considered a hidden disability much like ADHD and dyslexia, and it can be very difficult to diagnose. There are no clear physical manifestations of the condition in a medical sense, though the condition is diagnosed when a child displays the characteristics of AS. What causes Asperger's? Asperger's can be very difficult to diagnose for the reasons I just mentioned. As I mentioned before as well, it is also the highest functioning form of autism and falls in the spectrum. It is debated between scientists whether the disease is caused by genetics or external factors. I personally believe it's a combination of the two. Some of the key traits of the syndrome: those with AS often struggle with social relationships and communication with others. They tend to devote an obsessive amount of time on specific interests that usually isolate around themselves. They have a real fondness for routine and they have poor attention skills. Some additional side effects of the syndrome: tailored individual interest and flexibility to change, appear to lack empathy, have unusual facial expression or postures, increased sensitivity, and have delayed motor development, and also withdraw themselves around others. As I mentioned before, with the inflexibility to change and they're used to a routine, typically those with AS, once they are comfortable with the routine, they do not like to change it in any sense. Doing so often turns into a problem. Just to tell a quick story of mine, one day, one attribute I've noticed about Dave when I used to live with him, he, believe it or not, he was actually a stand-up comedian, excuse me. And we lived in Los Angeles, and he would focus intensely on his craft when he'd get home. And the second he would walk in, he would, he would say hi to me and my suite mates, but he would avoid eye contact, and social cues, and proceed right to his room and work on it. Uh, it seemed a little odd that he was ignoring us, but it was clear he understood the complex nuances it took to make people laugh and devoted his time to something considered by many to be one of the hardest ways to perform as an actor or comedian, whatever you want to call it. So it wasn't like the concept was lost on him how to interact with people, but it was just social cues and those instances where you bump into people where you need small talk or chit chat that he tend to struggle in. But as I mentioned before, he was super dedicated to a very individual skill, and his drive for that was unlike anybody's I've ever seen. It's just a quick story there. Treatment for AS. There's no one cure for AS. However, there are alternate methods that provide some relief for those who suffer. If you be younger, you place a child with AS with some sort of therapy to help combat the struggles that they would go to on a daily basis. The symptoms will still be there, but they'll have methods and strategies to fall back on so they can deal with whatever's frustrating them because of the disease. It'll never really go away, but with age and learning yourself, there's little things you can do to help, and that's the important thing: is to teach those tips when they're still young and their brain's still developing. Medications have also been implemented, but with mixed results. Unlike many other behavioral disorders, certain medications have certain side effects, which may or may not help the situation at hand. So, medicating AS has been seen with mixed results. Can those with AS go on to live a normal lifestyle? I like to think so. Those with AS have ways of managing the syndrome as they age, but as the side effects still linger throughout the entirety of life. Finding and keeping employment is usually a non-issue for those with AS, but finding the right job might take more time because for somebody with AS to flourish, they have to be in a specific environment that doesn't involve any of the circuit breakers, so to speak, that may cause a problem or may cause an issue for somebody with AS. They want to do tasks that are individual based and that they can focus on without having to necessarily deal with people on an hour to hour basis. Many people with AS have gone on to do some pretty great things. I know Albert Einstein has been documented having it, as well as Albert Hitchcock. So those are two shining examples of how those with AS have done brilliant things, and it has nothing to do with their intellectual capacity. It's more a social disorder than anything else. How to teach those with Asperger's. Children with Asperger's develop at different rates from those of their classmates. They have a capacity to display proficient abilities in subjects far beyond their age group, yet struggle to accomplish simpler and more common tasks such as remembering to bring their belongings with them, common motor skills. I think I touched on that a little before. Things like tying their shoes, handwriting, simple tasks for normal children often can be very frustrating with AS. So teaching somebody with AS might, comes with a lot of guidelines to make sure that the student is comfortable, because it doesn't take too much work, but it does take a certain amount of tweaking to make sure they're integrated. And as far as integrating children with AS, it's been general success. However, it's vital to have their parents on board with the child's academic development, because it's a process that extends to home. And it's not something that just happens at the school. It has to be, the parents absolutely need to be a part of the process and work hand in hand with the school, because nobody knows a child better than their parents. And if there's certain information that's not getting back to the school, then that's only going to impede their ability to help a child out. So, very important that parents get involved with the school. Asperger's at home, going on that a little bit more. Raising a child with AS comes with some hurdles, but can be ultimately done with the right guidance. Once parents are really aware of the syndrome's side effects and close to that with AS, they're able to understand the perception issues that come with the condition. So, if, for example, just telling you what I've told you about this, you might be able, if you know your child has Asperger's and he doesn't like certain social situations, you might avoid bringing him to a large party or something that may create some sort of discomfort or anything. I mean, obviously these situations they're important and they happen in life, but from day to day, to keep them comfortable, you have to guide them and know of the conditions, how it can take them over, but work with them and encourage them and know that, with a couple right steps in the right direction, they'll be functioning like anybody else. In my conclusion, Asperger's is a challenging hurdle to overcome during developmental years, and its side effects last a lifetime. So it's something you never really beat. It's something that sticks with you, but it's really not so much the end of the world, because, as I mentioned, there's very proficient members of the Asperger's community, and it's just a hurdle. Like I mentioned before, with the proper management, those with AS can live pretty functional, normal lives. Obviously, they will have to deal with what they have to deal with, but it's a syndrome that, with the right steps, can be managed for sure. There's some references I've had that helped me along the way understand this syndrome, and I was happy to do it. If you guys have any questions for me, I'd be happy to answer them the best of my abilities. Otherwise, I hope everybody has a great night. Take care.